It's now recording. You can carry on as normal.
Okay, right. Thank you, Chair. We're okay to go now.
Right, okay. So we move back to item 3, health challenges amongst children 0 to 5 years of age. A presentation from 2 members of the Cwmtaf Morgannwg Health Board. Jane McCain is present this afternoon and Lynn Harrington. So good afternoon, ladies, and welcome to the meeting.
Hi.
Good afternoon, thank you.
Chair.
Afternoon.
Sarah wants to give some background before we actually hand over to Lynn and Jane.
Yes, that was my next item. I was going to ask you, Sue, by way of an introduction, can you or Sarah, or indeed both of you, provide the relevant points before Jane and Lynn make their presentation? So it's basically over to you, Sue, and Sarah.
Yeah, Sarah, over to you.
Thank you. Thank you very much, Chair. For those of you who don't know me, I'm Sarah Osler, and I'm the Early Years and Flying Start Coordinator within the local authority. So thank you very much for inviting us along and giving us this opportunity today to discuss with you the health of our very youngest children and consider those health indicators that have remained really stubborn over a number of years. And how perhaps we can work together collaboratively as a council and as a health board to have a look at these stubborn health indicators and how we can work more jointly to address these health inequalities. So I will say before I go any further, I've got 2 children downstairs, 2 sons downstairs, so they're under strict instructions not to burst through the door. But in case they do, that's just a pre-warning. Okay, so just to give a little bit of background of some of the areas that we're going to touch upon today. You should have received the report that Chris Hole drafted in November 2020. And in that report, there was a number of the health indicators, and one of them was around the low birth weight. And the figures tell us that in 1819, which are the most recent figures, that of all babies that were born in Merthyr, 8% of those babies were born with a low birth weight, which is 2% above the Welsh average. Why is that really important to us? It's important because there's an increased risk of developmental problems in children who are born with a low birth weight and complications and poor health outcomes later on. You know, so when we talk about the RAS strategy and we look about educational outcomes for children, you know, children who are born with a low birth weight are likely to have poorer educational outcomes. So it's important that we drive down on those low birth weight figures so that we can improve developmental and education outcomes for children. Also within that report of November 2020, we touched upon the childhood obesity rates. Now, in 1718, and this figure never fails to stagger me, 35% of 5-year-old children were classed as obese or overweight. So that's a third of all of our children in reception class 1 are classed as obese or overweight, which I find is an absolutely staggering figure, and that is 9% above the Welsh average. So why is this important? Well, children who are obese in childhood, it's known are likely to be more obese as adults. And along with that comes the complications around health factors such as diabetes and cardiovascular complications. But also, you know, we're talking a lot around the well-being of our children. You know, if you're a child who has grown up as obese or overweight, you know, what is that doing to children's emotional and social well-being? And that certainly needs to factor into the discussions around childhood obesity. The other health indicator that's within that report is around the rates of dental caries. Now, these figures are quite historical, but they are the most recent that we've got, and that is around children who have experienced a decay, missing or filled teeth by the age of 5. and that is 56, just over 56% of our children have visited a dentist at the age of 5 because they're experienced problems with either missing, filled, or needed to a decayed tooth, which once again, you know, that is an incredible figure when we're looking at children's health and well-being. To end on a high with some of those health indicators, vaccination is on the, you know, the tip of everybody's tongue at the moment, and I'm really, really pleased to say, because of the work that Lynn, Jane and their teams are doing, that we've done really well around vaccinations and childhood immunisations in Merthyr. Historically, we've done really well. And we've, I think, consistently, Lynn, you can shake your head, consistently operated above the national average when it comes to the number of children who have their childhood immunisations by their 4th birthday, which is definitely something to celebrate, because that doesn't come easy. What I will say is that all of these figures are pre-COVID. It's really difficult to know what is going to happen to these figures post-COVID. Will we see an increase in childhood obesity? Have children had less physical activity and a greater influence of poor nutritional choices at home? We don't know, but that is certainly something to factor into any of our discussions today, is what the impact of COVID has been on some of these really stubborn health indicators. And I think what I perhaps would like to also touch upon is, you know, some the indicators that I've mentioned are really tangible. You know, they're quite easy to measure how we're performing against them. What is less easy to measure as we start to plan towards the recovery phase post-COVID is what has been the impact of lockdown on the emotional and social development of our very youngest children. You know, if you consider that babies have spent a large percentage of their life so far in lockdown or being socially distanced from their really close friends and family. You know, they haven't had access to the face-to-face parent and toddler groups that they would have usually have done. That can't go without having an impact. You know, we know that this first year of a child's life, this first 1,000 days, is a period of rapid brain development. 90% of brain growth happens by the time a child starts at nursery. So these children will have had a very different life experience than a child who hasn't experienced lockdown and COVID. You know, so what I think we need to consider in our deliberations is what support needs these very, very youngest children will have as we progress out of COVID. So I'm really, really pleased, as the chair has said, that we've got Jane O'Kane and Lynn Hannington with us today, who are going to deliver a presentation that's going to delve a little bit deeper into some of the things I've touched upon. And I'll leave Jane and Lynn to introduce themselves, while I really, really hope I can share the presentation.
Sarah, do you want me to try and do that? Because I've got it ready. Shall I go first? Because I've set it up to go. Is that okay, Sarah? I'll give it a try.
Yeah,
thank you,
no
Jay.
problem.
If I just introduce myself and Lynn first. Our names are on the presentation, but I've got a couple of different titles. So my usual job is Head of Nursing for Children and CAMS, which includes health visiting, and I'm also the Systems Director for Preconception to 1,000 days. At the moment, I've been seconded for 3 days to support the neonatal services along with the maternity work that you'll be familiar with. But I'm here to support Lynn with my systems role. Lynn, as you perhaps will be aware, is the senior nurse who covers health visiting services across Merthyr. So I will do my best now, and then I may well call Sarah on if I fail to do this. I'll just hopefully share. Just hopefully this is the right one. Bear with me. Okay, so we were asked, can everybody see that before I start? Is that all okay? Yeah, everybody got sight of that? Is that okay, Sarah? Can you see?
Yeah, we can see that.
Yeah. Okay. So we were asked two specific questions in relation to health visiting. One, what is being done to address the challenges and the priorities? And secondly, what can you as a council and local authority support in relation to those issues? So we've tried to put that in context of the Health Board's new operating model and, of course, the COVID pandemic, because the two are quite significant for obvious reasons. Our aims then are obviously to be able to answer your questions, but to touch on population health approaches and, as I say, an overview of the new operating models, which are still to fully come into play. Local context and health inequalities and the challenges that presents us. Obviously, Sarah's touched on some of that. Public health priorities within health visiting services and whole systems approaches going forward. So I'm assuming you've perhaps had sight of this, but essentially, as you know, we've got 3 integrated locality groups, and those have come into play. But what hasn't yet happened is the change for children's services. So purely because of the COVID pandemic, children's services are all being hosted at the moment by Bridgend Integrated Locality Group. And essentially going forward, the intention has always been that the new operating model would have greater scope to deliver on population health approaches and to develop values-based pathways. I think it's fair to say that work has been massively stalled, hugely frustrating. But obviously the pressures of the pandemic you're familiar with, and that has clearly had to be a priority. So just to touch on the system's objectives. So whilst the ILGs of the integrated locality groups have come into play, what hasn't yet been implemented is the new systems. There are 4 new system groups and there'll be 4 new systems boards. So there'll be preconception to early years, there'll be 5 to 25, there'll be adulthood, and there'll be the older person. So there'll be 4 systems, and these, I won't go through them all, you can read them at your leisure, but essentially those are the principles and the objectives for the way we anticipate working. And it has been taken from a model that's been implemented well in New Zealand in terms of the principles, but obviously what's happened is a local interpretation has been added to the approach. Okay, so I suppose what is absolutely key is that co-design and creating services with our communities, and that is a piece of work that we had started to do in terms of young people and setting up a health youth forum, aligning it with the 3 local authorities, youth committees and youth forums. Again, unfortunately, that has stalled, but we are looking at picking up that in terms of virtual work, and that's ongoing, because we do need to involve, obviously, our families and our young people in developing our services for children and young people. So specifically then, we'll pose 2 questions. And the first one, obviously, as you're aware, is what's being done to address the challenges? And secondly, what can you as a council do to assist us in improving the health and wellbeing of our children? So first of all, as I said earlier, we're going to touch on the challenges and the priorities. And I'm going to hand this over to Lynn now, who will pick up some of the operational specifics locally. Okay, Lynn?
Yeah, thank you. I think that Sarah's actually touched on quite a lot of it. Thank you, Sarah. You did a little bit of the work for me. I'm sure that you all know and have had a chance to read some of these slides. And I don't want to bore you with slide overkill. You can see that, Merthyr, we do have quite a lot of safeguarding referrals. Quarter 1 is usually the highest, but it's pretty, I'd say it's pretty level, and it's at the moment the referrals don't look as high as they do normally, but I think recently we've had a lot more referrals, so I don't know if this is that accurate. So if we can have the next slide, Jane. I can't move it on because you've got control. Jane?
A minute. For some reason, it seems to be jammed. Bear with me a second. You can't move. Oh, right,
No,
okay.
I can't.
There we are.
Yeah, okay. And Sarah rightly said about the low. You okay? As Sarah rightly said, our low birth weight rate is the highest. I've got a bit of I'm echoing a bit. Has somebody got their can everybody mute if they're not talking, because otherwise I sound like I'm echoing. So as you can see, it has gone down a little bit in Wales from the 1920. We haven't got any recent, obviously, data. But Merthyr has been high, and Sarah is absolutely right. Along with Blaen y Gwent, we are two of the highest in Wales. There could be a lot of reasons for it. It is a socio-economic, I think, issue, really. But there are other issues. There can be medical issues. So we probably need to look at it from a public health perspective in more depth, because I don't think we do look at it enough. There are other issues that can cause low birth weight, such as medical issues, such as certain hormones and enzymes that are carried by women that we don't test for in CumTAF, but we do in Cardiff and other areas. So there are some issues that we could look at in CumTAF differently, I guess. But I'm not saying it is that, but I do think that it's not a single factor as far as low birth weight is concerned. We do need to look at it in a more broader sense from a public health perspective. The next one, the looked after children population, I think we were third. I'm not quite sure what that means at the bottom there, Jane, 16th. I don't know. I think that must have been a different time, was it? Yeah, okay. So if we go on to our immunisations, and I know, Sarah, you said we haven't got recent data, but we do actually have some for 2020. And I'm pleased to say we went up even further. So we are actually the best in Wales at 91.9%. And you've got to question yourselves as to why our population seem to comply with bringing their children for immunisations. It's a big question I ask myself every day, because I often think to myself, we tell them about diet, nutrition, about their children being overweight. We talk to them about going to the dentist. We talk to them about caries, and health visitors go into all this into lots and lots of depth. But it falls on deaf ears, obviously, because our figures remain high. But for immunisations, they attend, and they are very, very good at attending, and our rates are the best in Wales. So we have to ask ourselves, what is it, how we sell that to our community that makes them attend? And I think we need to dig deeper after this COVID disastrous time. We need to look at how we address these issues with our community, because if we don't, we're never going to bottom out these issues such as obesity and caries. We need to find out why our population in Merthyr is different. I mean, I'm a Merthyr girl myself, and I actually think we are different. I don't think we're very good at listening, but when we do make up our minds, we're pretty, stable about how we feel. And an interesting fact, which Sarah didn't bring up, was the breastfeeding rates. Now, in Wales as a whole, the breastfeeding rates are not that brilliant. But I've looked at it, and I've spoken to our breastfeeding specialist, because she's done more work, obviously, than we have. But our breastfeeding rates have gone up slightly this year. And if you look at the rates, you haven't got the slides, but in 2016, for example, it was 49%, the breastfeeding rates in CumTAF. It went up the following year to 58%, and this year during COVID it went up to 60.3%, which is good news for us. It seems a small percentage, but any increase is a bonus to us. And I did ask if we could break it down, and I think it is possible, but it's quite difficult to break the data down, and it's quite time consuming. But going forward, I have asked our breastfeeding specialist if she will try and do this on a monthly basis, so that we can see in detail a little bit more the breakdown of where and what the figures are, how they reflect. And what she did notice when she did some work last year, she said, was that in Tafili, for example, it was just an example she gave me, the starting breast rate, so the initiation of breastfeeding at birth, was quite significantly higher than Merthyr. It was something like 60% compared to 45%. But at 6 weeks, Merthyr maintained their breastfeeding rate longer than Tafili, which was quite interesting to me, because it sort of indicated then that at birth they said they were going to go into breastfeed, but they didn't continue. But the Merthyr people said they were going to breastfeed, and a lot of them continued for longer. So I suppose there's something to analyse in that. What, I don't know, but I think it's something we should look at and try and work on that basis, that maybe they are very determined at birth. If they don't want to do it, then it's difficult to change their mind. So maybe what we need to do is start working on how we change their mind to start with, and then how we maintain it going forward. Because breastfeeding, if we can get them to breastfeed, it will affect obesity, and it will reduce obesity, as we know, going forward. So I think from a doing perspective, that is one thing that we could have a win-win if only we could get that magic formula, I guess. And I think we are all working at it, but COVID has caused us a lot of delay in everything that we've done this year. We are actually following the Healthy Child Wales programme now. We are seeing mothers face to face, and I think we are one of the only professionals who are doing it on a regular basis and having regular contact with parents, because what we found after the first wave was that, as Sarah rightly said, there is a lot of postnatal depression, there is a lot more safeguarding, a lot more domestic violence, which is quite stark, and that parents need a lot of support. We didn't visit them enough in the first wave, because obviously Welsh Government told us that we sort of withdrew some of the Healthy Child Wales programme contacts on their advice, but we realised that that wasn't helping families at all, and we're back in there now with families and visiting them, and I think making a bigger difference. And we don't want to stop doing that, because I think they need us to be going in and having face-to-face contact. I think, Jane, you put this up, but I'm sure you all know in Merthyr about our economy and our unemployment rates, which are significantly high. And I think, Jane, you're going to do the priorities. Jane?
Thanks, Lynn. Can you hear me? Yeah. Okay. So yeah. In terms of the response then from an early years health visiting perspective and the core priorities, bear with me a minute, my arrow keeps sticking. Gosh. Right, okay, so as Lynn said, delivering the Welsh Government Healthy Child Wales programme, that is absolutely a core priority, and these are the areas that are absolutely key to the delivery of that programme. So these are the areas that health visiting teams target, and they deliver specific pieces of work in relation to these that have got an evidence base behind them. They are all very challenging, or can be very challenging, I should say, in terms of delivering that advice and support to families, and it is hugely complicated if you've got chaotic lifestyles. So if you've got domestic abuse, if you've got families where there's been attachment issues for the parents when they were children, and it's breaking that whole cycle. And then in terms of delivering health messages, I think that in terms of immunisations, I wonder if it's about the strength that actually our GPs have in terms of them being able to get, I don't know, for some reason or other, as Lynn has said, and Sarah, immunisations is always CMTAF was always known as the best health board for vaccination uptake, certainly with the little ones. And there's something I think about primary care and the value and the respect perhaps for what the GP is saying about that. Family health and nutrition we've touched on. The obesity agenda, as you will all know, is hugely complicated. It's hugely complex. We also have other worrying figures about older children and increase in eating disorders at the other age range, which we haven't touched on, but that's equally concerning. And obviously social media doesn't help that. Cot death, as called it, sudden infant death syndrome prevention and sleep risk management. Again, there's a raft of evidence-based work. We are due to start across the piece, all families being taught basic life support, but again, that's hampered by COVID and the types of visiting we can do. And the focus ultimately on school readiness, having that child who is school ready. So those are areas of work that are all entwined right through the Health Child Wales programme, whether it's Flying Start or outside of Flying Start. In terms of COVID then, clearly you're all more than well aware of the local infection rates, and unfortunately, because COVID is, the data is that there's, the rates of COVID are higher in some of our more, poorer areas, and the impact and the consequence of both COVID in terms of the impact on families from a physical health issue, but also from the perspective of mental health, safeguarding and domestic abuse. There's emerging evidence coming across from England to show that the children, when they did go back to school in between the lockdowns, they were seen to have behaviour that had regressed. So we had children whose speech had got worse and were back to nappies. For Lynn and managing the team, there's been particular challenges because, as she said earlier, we did have to modify the Health Child Wales programme, and we still have to do that, but to less of an extent, because obviously we've got to risk assess families and our staff in terms of safety. We were asked by Welsh Government to redeploy health visitors back in the spring, and this time we've had a small ask for that, but very much cut back on that. So we have had a couple of staff who've had to go in and support our intensive care, our more critical areas, and also our field hospitals. The position at the moment is that we don't know if we might have to do more of that. We really don't know at this stage. I'm sure you're really well aware that our acute hospital services are struggling because of the demand due to COVID, and also the staff absence due to the sickness also related to COVID. And also Lynn's had to manage COVID staff sickness and absence within health visiting as well. So it's been a hugely challenging year for the public health nursing teams. In terms of the resetting agenda then, clearly we need to listen to our families and respond to their needs. We need to learn from the emerging evidence, but I think it's fair to say that health inequalities are likely to be worse. And I think we'll be in the position where we need to start to look at possibly developing new and different approaches collaboratively across the public sector to best support our families. So, Lynn, you're going to pick up with these because you're more familiar with these operational examples. I'm going to try not turning myself off on mute because I'm on a roll with the thing. Okay. But if you echo, I'll turn it off.
Okay. Okay. I approached the public health information, and they gave me this, which I'm sure, Sarah, you are aware of anyway. The 35k one-off funding for Merthyr Tydfil area via Dan Bufton to digitalise the PA offer, discussing ongoing, but I don't know how far they've got. Sarah, you might be able to enlighten us with that. No? Okay, so this is what Public Health Wales provided us with, this information prior to this talk. The next one, Jane.
Lynn, do you just want to elaborate on what we mean by the PA offer?
To be honest with you, Sarah, I don't know. I thought you might know more about that than you might know more about.
Okay, I definitely think that's an action from today's meeting then, that we link up with Dan and see where we're at with that then. Yeah.
Was it that meeting that we had up in the 3Gs? If you remember having that meeting, you were there. And it was about extra funding for parenting.
Pass. I don't know, Lynn. Sorry,
Yeah, I think it
can't
is
help.
that meeting.
Right. I'll
think,
make a note now, Lynn, and we'll definitely chase that up with Dan and make sure that we know where the progress is.
Because I've heard nothing back from that. So research funding to identify the childhood obesity system and measure progress against our targets to improve and motivate the system. And I think what public health was going to do was try and look at a systems approach really to obesity. But again, because of COVID, that's on hold. Commissioning of a family information service and campaign, including content, webpage, social media and marketing, which I think that's been on hold. You did do some work on it, Sarah, didn't you? And but we did it separately from Public Health Wales. And that is something that I'd like to say that we set up our own Facebook page ourselves, the Health Visiting Service in Merthyr, and it has been very successful. And we have sort of buddied up with the local authority, early development language team and others to provide information to parents out there on anything relevant to the child's development and for parenting issues. And it's been rather successful, actually, we were pleased to say. Commissioning of a healthy family notified programme across CTM to improve choices for CYP and families. I think this must be to do with the systems approach with early years, because half of this, Sarah, we have had no feedback via the local authority, so I don't know how far you've got.
I think it's fair to say, Lynn, probably a lot of this work was ongoing pre-COVID and has stalled and staggered. But this is the work that locally has been progressing to date, isn't it?
Well, this is what Public Health Wales told me, but this was obviously back in October. And I guess everybody has been preoccupied with COVID and, you know, a lot of it is on hold, but that was what was started. And I'm hoping that, you know, when COVID settles down, if it ever does, we'll be able to recommence all that.
Okay, so moving on then, in response to question 2, these were the issues, Lynn, if you can talk through these. This is some of what I think earlier services felt that the local authority could help consider or could look at and consider.
Yeah, well, I think when you look at, they're old chestnuts really, the environment, you know, we all want our children to have access to safe play. Again, COVID has really had a massive influence on this because children can't go out and play in a play area, they can't go out and play together. So it has had a horrible effect on children. But even without COVID, access to safe play and access to free recreational activities with additional sporting opportunities is really good for their health, and it's obviously going to help control their weight. So that is something that the council can help with, I guess. Healthy choices, greater engagement, health service delivery and health ownership. Yes, we all need to own what we say, and if it comes out of our mouths, then we do own it. So we do need to do something about it. And the only way we can do that is together. And I think that working together with the local authority, and I think we do it very well in Merthyr, I'm pleased to say, but we could be better. There's areas which I have to say I do find really hard to swallow, and that is all the outlets and food outlets and fast food that is available and in abundance. And you only got to go up to the Gurness estate and see how many takeaway and junk food outlets there are in one small area. And that area is the one area with the most deprivation and where we are based, and we see it every single day. I just wish that we didn't have the access to that. I mean, you know, a sweet shop, a kebab shop, a fish and chip shop, it goes on, and it's not healthy food. I know we can't force people to eat healthily, but you know, when it's there on their doorstep, it's easy, isn't it? We all want easy. They're no different to the rest of us.
I think what's difficult in that area that you talk about in the Gurness, Lynn, is actually there are no healthy choices.
No.
You know, if you go up there and, you know, we've got facilities up there and you try and get a healthy lunch, there are actually no options.
No.
You know, so it's not the, you know, it's not just the abundance of the unhealthy options, it's the fact that there isn't any options. There are no outlets to try and get anything healthy. And I definitely think, you know, that that's something that as a council we can perhaps consider jointly as to how we can encourage more establishments with healthy choices to come into that area.
I mean, I'm not a person who forces people to do anything they don't want to do, because I don't think that works. But I think if you've got an option there, at least you could try to influence them. But I think there is, as you say, Sarah, nothing in that area that is healthy. So it does worry me, and it does concern me, and it concerns the whole team who are based up there, who look out the window every day and see it. So that would be something the council could influence. And the other thing is about sustainable models, so that if we start something, that we can finish it. You know, that we don't have to keep having to reapply for money all the time to do things. I know, you know, when you do something like they did the Merthyr Girls Matter and all of that, when, you know, people were encouraged to do physical activity to keep healthy, then it's short-term funded, and when it stops, and then, you know, it's spoiled because all the good work is undone. I don't know what we do about it, because there isn't a massive pot of money, but I think we should be encouraging the whole community to do healthier things, and that's including exercise. And obviously we long-term sustainability. So what we want is, it's like Flying Start, isn't it, Sarah? You know, we worry every year that it's never going to go on and keep going. And we know it's working, and we want it to carry on because we know that it's making a difference. But we do worry every year because it's not permanently funded, and we do worry that it's going to stop and then we'll regress. So you know, we do want long-term sustainability. Engagement with the new UHB population approaches, and that's the transformational work program. That's, you know, was going very well before COVID, and hopefully we will pick all that back up again when this finishes.
Thanks, Lynn. Yeah, that's great. So in summary then, I have referenced Professor Marmot. He, I'm sure you'll be aware, he's a leading professor in epidemiology based in University College London, and is a real champion of addressing health inequalities, and feeds into all sorts of World Health Organization piece of work, and he's a health visitors guru, really. No surprises then, and he repeated this in 2020, that action on health inequalities requires action across all the social determinants of health. It's evident that you know, that includes education, a decent standard of living, a decent salary for a decent job, a decent home, and living in a decent community in order to address those health inequalities. So the intention for us is that we will always fight to continue to deliver the universal progressivism model, whereby everybody gets the minimum, the minimum being the universal component of the Healthy Child Wales programme, with those in need as assessed for need and risk, get more, and the more should be evidence-based, and the innovation should be outcome focused and grounded in research and development. And in my new role, I've managed to secure 2 of the lecturers from the University of South Wales who've got background in early years. They've got an honorary contract with us now in the Health Board, so we can really make sure that actually the huge amount of good work that goes on is also captured, because that's something that we're quite poor at doing, is actually shouting out about the good work. And there is a lot of good work that goes on in CUMTAF in the early years, but I think we're really poor at demonstrating that and shouting about the so what, because it's very easy to focus on the what's that's not going on very well, but actually it's I think it's a challenge to us to turn that around. So the thread has to be the focus on prevention, supporting and preparing young people for adulthood and parenting, and developing families who are more resilient, who have greater self-esteem and ambition. And critical to that is that we have systematic and joined up local and regional approaches to service delivery planning. And whilst I think Lynn's right, we have lots of really good examples of models across our partnerships, across the public sector. But I think our poverty profiles before COVID were telling us that perhaps we need to challenge ourselves and maybe look differently, maybe consider, you know, can we do more? Should we be doing something differently? Are the pathways we've got for our families and children right? You know, is there a better approach that would address those health inequalities better? And I think clearly with the COVID crisis, that I think there's going to be a greater demand upon us to do that and get that right. So those significant consequences, the impact of COVID, we really have to address. And just finally, Professor Marmot, make no apologies for a final quote from him last year where he said that every society will have some level of economic and social inequalities, but what we can envisage and work towards is a society that creates the conditions for everyone to be able to lead lives that they have reason to value. And I think as a health board, what we want to do is develop the strategic approach with all of our partners that really drives that forward, because ultimately we don't want any child to be living in poverty and to suffer the consequences. But clearly that's very aspirational. But I think for us as a health board, we need to be aspirational and to try and achieve that. So that's come to the end of our slides and our presentation. Thank you, Chair.
Before we bring in ask for any questions, this is the one advantage, I suppose, of working virtually. Dan Bufton's come back to me, and on the query of the 35k, he is working there. Him and his team are working with Public Health Wales at the moment to propose the best use of that 35,000, alongside additional money that they've had from Sports Wales. Guidance from Public Health Wales is that it doesn't necessarily all have to be around digitising activity, as long as there are key benefits shown. So what Dan and his team are looking at, support for outdoor spaces, which also links in with some work that we're actually doing with schools, or with Play Wales on community play spaces in 5 of our schools at the moment. Support for online delivery with the leisure service, and some support for facilities, and also some virtual family challenges at present. You mentioned as well the girls' approach, Lynn or Jane, I can't remember, Lynn. That is taken forward by Emma Christopher. Although there was money for it originally, there is a proposal, there is some work going on with girls in...
Yes, there is, in Treharris.
And now in the south. So it has been spread out. So we are sort of looking at that. So there is a lot of ongoing work with Dan's team to actually do that. A lot of it is with schools, but we need to sort of do that. So it's going on with schools. We need to get the younger children involved and the mums and dads involved as well. And we're also looking at work with our comprehensive schools to ensure that their physical activity and their fields, their physical activity settings, so they're specific, the running track down in Avontaff and places, and the 3Gs pitch in Bishop Headley is actually going to be open for community assets, as a community asset. So the public are going to be able to use those facilities again for physical activity. So I think that's something, you know, that we are working with Dan and his team to ensure. But
that's lovely, Sue. Thank you so much for that. And I did know about the Treharris involved with the girls, but I know it's been on hold because of the COVID. But I was very positive about it. I know it didn't take off as much as the women, but I think it's just about a confidence thing with the girls more than anything. So there are good things going on, as we say, isn't it? It's just we've had a bit of a stall.
Yeah, when I spoke to Dan as well, he was talking about the free swimming offer.
Yes, that's fantastic.
But actually offering some to families.
Yeah, I agree with that. That was very successful, and because it is expensive to take your children swimming. It's a big effort as well, mind, you know, especially if you don't want to go in the water yourself. But actually, it is very healthy thing to do, and I would support that wholeheartedly. But we can't do it at the moment, so But for the future, let's do it for the future.
Okay. Thank you, Chair. Over to members, I suppose, for any questions now. Jim, can you unshare the presentation?
Oh, right, sorry, I thought, has it gone now?
Yeah, lovely.
Still here. Are there any questions from members? Questions before Jane and Lynn obviously leave us? Any questions? No? Any observations? I think they're likely to come out with observations once you two ladies have gone, because we come back to the recommendation then. So before I leave you go, can I say this? As far as the presentation was concerned, it was a real professional, detailed and absorbing presentation. There's no doubt about that. I enjoyed it from start to finish. And I think it's bringing a few things home to us where we've got to really question whether we ourselves as a local authority are doing enough. And I was interested to listen to the observations regarding the takeaways on the Gurnas, because you can go anywhere in the county borough and basically you'll see the same takeaways. What we do about it, I don't know. So anyway, girls or ladies, thank you very much for that presentation. If you want to leave now, you can, but we'll be moving on to any questions or observations from members before we come back to the recommendation on the first page. So again, thank you very much.
And thank you, Chair, for welcoming us. It was a pleasure.
Yeah, thank you very much.
Bye.
Bye-bye. Right, okay. And I go back to members again and ask whether there are any questions that members would like to pose to the officers now. No? Any observations? Is Sarah still with us now? Sarah?
No, it looks as though Sarah's left.
Just gone? Well, can I, and you can pass this on to Sarah, that, you know, her contribution was second to none. And with people like Sarah in that department, the ICS, I mean, they've got excellent staff taking the service forward. And she did a wonderful job here this afternoon. I was wondering what indeed we were going to hear, because we're so used to listening to Chris. But Sarah, she expanded on a few things that led into the presentation. And I, again, was very, very impressed with her. So if you see her, tell her that as far as I'm concerned and the committee, we thought one heck of a lot about her contribution today.
Will do.
Okay. So we are now back to the recommendation, which is on page 3. And this was the part of the meeting when I was going to ask Sarah what she actually thought we should do with this recommendation. But because Sarah has left us now, so we come back to you reading that recommendation Are you happy for us to accept that?
Yes, I think, Chair, what we, that conversation about the takeaways and, is I don't know, there's nothing that this committee can actually do about that. I think we are working closer with Dan and is keeping that on the agenda, and it may be something as we move into the new academic year that we've had this presentation from health this year, but perhaps we need to ask Dan Bufton and his team to actually come along to Scrutiny next year to consider how the physical health of the from early years right the way through to 16 and further is actually taken on board, because it does fit in with the RAS strategy. It is that wider aspect of health and well-being, and I think that's possibly something that we could take forward.
Yeah. So at this point in time, then, so we can accept that recommendation. Okay, members, all in agreement? Yes, nobody against? Okay. Right, so that's it now, Sue, as far as you and Lisa are concerned. We're now moving on to item number 4, is to look at the forward work programme. Okay.
So do you want us to go? Do you want me to go and then, or do you want me to stay for this one, Chair?
If you feel you've got a contribution to make on the forward work programme, I've already had a chat with Lisa regarding a piece of work that she would like us to scrutinise, and I intended running that past you next week. So he's disappeared.
Yeah, looks like we've lost Sue, don't we?
We've lost Sue by the look of it. Well, we'll move on quickly to the forward work programme, and members would have had the opportunity now of going through it. Come the next meeting, which is in February, there are 3 items, I believe, on the agenda. So that basically is filling up our agenda for February, which has got a knock-on effect on Lisa's issue that she wished to bring forward. So we'll try and get over that. There's a couple of ways of doing it, but Saeed and myself will get together and bounce it off Sue, and so that's the forward work programme. I don't know whether members have got any issues that they wish to bring forward, or you're prepared to leave it until the February meeting. Right. On to item 5, which is the scrutiny referrals, feedback and follow-up action. Well, I've already broadly mentioned a referral that has been made at this point in time to myself. I would discuss it with Saif and Sue, and that may appear in a future item agenda, if not for February, certainly for March. And then on to item 6, which is the reflection and evaluation of the meeting, usually left to myself, but I'd like to have one, if not more than one, member saying what they thought of that presentation. Obviously, I had my say when they were here.
I thought it was a really good presentation, really interesting. I think a lot of what they said regarding, at the moment, we're very in the black and we don't really know what's happened over the last 10 months. So I think it'll be really interesting to see what the future holds really, and what developments are made, and what data we do get in the future, and how much of an impact COVID has had on our, especially the children 3 years and under. So I think that'll be really interesting for us to look at and to scrutinise over the following couple of months when we do get that data.
Thank you very much, John. Any other members now before we finish?
Again, it was spot on. The entire presentation was short, sharp, and informative. We couldn't ask for any better.
Yeah, it impressed me. Anybody else now?
Yeah, it will be interesting, Harvey, that after the COVID, not after the COVID, COVID's gone for a long time yet, to see what the outcomes come after the COVID has finally ended. What the outcome of these results are.
Yeah, thank you for that, Howard. Okay, well, if there are no other observations, I thank you all for attending. It's basically 1701, so we didn't do too badly at all, 1701. So thank you all for attending, and wish you a speedy journey and a safe journey home. Thank you very much.
Thank you.
Thank you.
Stay safe, everyone. Take care. Thank you, Harvey. Thank you.
Thank you.